start. And I'm going to go talk to one of the other nurses, and I'll be back in a few minutes to check on you to see your pain is, okay? If you need anything, before we come back, just push this button, okay? You got me just a moment. Hey, Sandy. How are you?
Good, how are you?
Good, good. Listen, do you mind if I talk to you about one of my patients?
Sure.
Okay. I kind of need help developing a care plan for her. She's an 87-year-old female client. She has diabetes mellitus and peripheral diabetic neuropathy. She also has a history of hypertension. I think she's in a lot of pain. This morning when I walked into the room, I noticed she seemed a little agitated. She hasn't seemed that way in the past. And when I asked her if she was in pain, she stated she was at like a level 6. And it's in her left foot, and it increases with movement. She's Lord-oriented times 3. Her temp was normal at 98.4. Pulse was 68, respiration 12. Blood pressure was 130/80, though, so a little bit higher than what's normal for her baseline. So I think that that was one of the things that indicates that she might be in some pain. She did have a left ankle fracture that was repaired on 3/13/11. She had a finger stick earlier today, according to her chart. Her blood glucose was at 128. But she says this pain has been going on for like 8 months now. Is there any way you can help me come up with something?
Well,
Or a care plan?
You described some characteristics of her being agitated and complaining of pain for the last 8 months. It sounds like she's having chronic pain, but as we all know, pain's a separate disease. So maybe we should check the nursing diagnosis book to verify. After discussing the client, checking the diagnosis book, Nurse Eileen and Nurse Sandy come to the conclusion that Ms. Lowry is suffering from chronic pain related to peripheral neuropathy secondary to diabetes mellitus and exhibited by complaints of pain for the last 8 months. They also determined that the client is at risk for falls related to impaired mobility as exhibited by a fractured ankle that was repaired on 3/11, and a risk for impaired skin integrity related to the immobilization. They decide on their next and knots, and they head to the bedside to discuss their plan with the client.
Sandy, it's been about 45 minutes since I gave my client her pain medication, so I wanted to go check in on her. Would you like to come with me so we can discuss what's going to happen? Mrs. Lowry? Hi there. How are you feeling?
Much better.
Good. How's your foot?
It feels better.
Excellent. Let me ask you, I know you were in a lot of pain earlier this morning. If you had to describe your pain to me right now on a scale of 0 to 10, 0 being no pain and 10 being the worst possible pain, what pain level are you experiencing?
I'm at about 3 now.
So that seems to be helpful. This is my colleague, Sandy.
Hi.
Hi, Ms. Lowry. My name is Sandy. I'm another nurse. On the unit, I'll be helping with your care.
Okay.
Eileen and I have come up with some goals that we'd like to discuss with you to help manage your care and help you with your pain.
Okay.
Our primary goal for you would be to try to keep you as close to pain-free as possible.
I love it.
This would include giving you your pain meds on a regular schedule to keep your medication in more of a therapeutic threshold, so you're able to move and get around with little or no pain. We'd also like to assess your pain level before you begin any activities to decrease the possibility of you having an accidental fall. Perform daily skin sweeps to check and make sure that your skin staying intact, dry, clean, to reduce any breakdown of tissue. The nurses and the client agree on the interventions and the goals, and after 2 weeks, they decide to follow up with the client to see how it's going.
How have you been feeling the past couple weeks?
Better.
Have you been experiencing any more pain or?
My pain is controlled. I do still have some, but it is better controlled.
If you had to rate it on a scale of 0 to 10, 0 being no pain and 10 being the worst possible pain, what would you say your current pain level is?
It's between a 3 and 4.
Excellent.
After their evaluation is completed, the nurses decide to carry on with the care plan as it seems to be. Okay, now we're gonna play a little game called Nurse Jeopardy. In the game, the first few categories will relate to chronic pain. The last three categories will mainly relate to the actual nursing process. As you can tell, the categories are, in fact, the different levels of the nursing process, implementing and evaluation. I'm waiting for my assistants.
About 5 minutes. The rules, we have to answer in the form of a question.
Yes, okay. Does everybody know how to play Jeopardy? Okay. Well, when you pick your category, I'm gonna actually read the answer and you will need to respond in the form of a question as what is such and such. I think I made them all what is, so I gave you a hint. And
What it is.
Do we have to wait until you're done asking the question?
well, at random, my Vannas are going to choose whoever wants to participate by raising their hand.
Not a little for.
Yes. Sandy? I guess Teresa's the only one raising her hand, so. What category would you like?
I will take assessment for 2 candies.
A scale that uses a 0 to 10 range to measure pain, 10 being the worst possible pain.
What is the Braden scale? What is Norton? Oh, that is the skin. Oh, gosh, yes.
Sorry. No, those are both for,
Skin?
It's the Chinese guy.
those are both for a coma scale.
The Braden Norton, that's like the skin.
They just,
Straight out of the book.
it's a Chinese guy.
What's the Newberg scale?
Yeah.
Numeric scale.
Numeric scale or the 11-point intensity scale.
Oh, so it's the numeric scale. I thought it had a name.
It is, that is the name.
Susan
Okay.
Jennings.
11-point intensity scale or the number scale. Okay.
I'll take 1 candy.
Assessment?
Yep, 1 candy assessment. Put it on the line.
Okay. A mnemonic for a characteristic onset